Welcome to Spotlight. I'm Sue Rakowski, and I'll be talking to Kelly Baker on today's show. Today's show is sponsored by Semco Energy Gas Company. Kelly, welcome to Spotlight.
Thank you.
So tell me, what is your title? What do you do with the St. Clair County Health Department?
Well, I am a social worker, and I am now the public health supervisor for our off-site clinics that specialize in child and adolescent health.
Okay. Well, let's start, first of all, we have a teen health clinic right now in Port Huron. Tell me where that's at and what kind of services you offer.
So they are located on the campus of Port Huron High School, kind of behind the Performing Arts Center, behind the gym area there. And they provide things like immunizations, comprehensive physicals, STI testing, mental health services.
Okay. And that's available for what age range?
They currently cover 10 to 21.
10 to 21,
Yes.
okay. So very convenient for obviously students at Port Huron High to have access to healthcare. Wonderful. So you're going to be expanding those healthcare services in some different areas of our county. Tell me about that.
Yes, so we were just awarded 2 new grants from the state of Michigan. One of them is allowing us to bring this very similar model to Yale High School.
Nice.
So it'll be on the campus of the Yale schools. That will actually cover ages 5 to 21, so kind of all encompassing. Same kind of services, so we'll be doing medical health as well as mental health for all of the students, again, age 5 to 21 that are residents of Yale. And then we also will be doing one in Algonac. Right now, we have just mental health services available, so we'll be adding a nurse practitioner to that staff down there and again, expanding that to include the physical health as well. And that also will be from ages 5 to 21.
And you mentioned it's in the process. When are we thinking we're going to open up?
So we are, again, very beginning stages.
Okay, very good.
But we are hoping to have some limited services offered at both of those clinics by the end of September.
Okay. How did you determine the areas? Just, it was based on a need, I'm sure.
Yeah, so we looked at the demographics of each area, how much services were available for the students of that area as far as physical health and accessibility, so transportation barriers, things like that, to be able to identify what areas might be in more need.
Okay. You're probably not even in the hiring phase yet. It's still the physical structure?
Correct.
Okay.
So we're hoping to have maybe those positions posted, I'm hoping no later than June, so that we can get them kind of onboarded and trained and things like that before those clinics get started.
So how will it work at all the clinics, even the existing clinic? You just call and make an appointment and go in? Yep.
So they would call, make an appointment with the clerks that are there to schedule that, whatever the need is, whether it's a health checkup or mental health services, and they would get them on the schedule and get those services established. Once school is in session, again, they'll be right there on campus. So the goal is to try to keep kids in school as much as possible.
Sure,
so we're not pulling them out to do appointments or having mom leave to work to do appointments. They can go to their appointment, get what they need, go right back to class. They can write prescriptions and have them e-scribed to the local pharmacy so the parents can pick them up after work. So we can keep these kids, attending classes as much as possible.
That's wonderful. And so really the goal, keep the parents at work, keep the kids in school, brief little trip over to the health clinic, and you're in good shape.
Yes.
Okay, wonderful. Where can people in the future here look for more information?
Social media, for one. I mean, we're going to have blasts put out when we start, collecting our community advisory board. We want a lot of input from the community. So staff of those schools, students, medical professionals in those areas, parents, we want to hear what you want to see these clinics have. So there's going to be a lot of information put out about that. The schools are developing their own kind of press releases, I guess you could call them, where there's information. And if they have any specific questions, they absolutely can call the health department and we'll answer them as we can.
Well, certainly filling a great need in our community, so we appreciate that.
Yes, that's what the goal is.
All right. Well, thank you so much for being on today.
Thank you for having me.
Of course. And thank you for watching this edition of Spotlight.